Hello, welcome to my Chief Exec's message for January. I'm sure a lot of you will have seen in the media over the last few weeks the massive demand that there is on the NHS and the pressures that we're facing. So these demands are across the entire system, and we have also had a high level of demand. But I'm really pleased to say that, particularly in our acute wards, that we've managed to make sure that no patients are sent out of area, and we've managed with the demand that we've had. A lot of this has been due to the fact that we've opened up the new Lotus Assessment Suite, which is designed to enable people to come in for an assessment, a short-term assessment, and this new service has been really successful in making sure that people don't get admitted where they don't need to be. So over 75% of the patients that they've seen have been discharged back to home with community support and may previously have been admitted. So it's very early days still in terms of the operation of this unit, and we'll do a full review of this in February and March. So of course it wasn't just the psychiatric decision unit that has helped to manage demand and provide an excellent service to our patients. This is of course a big thanks to everyone who's working on wards and in our community services and crisis services, who've really worked hard to cope with this extra demand over the recent months. A couple of changes that I need to update you on board posts. So some of you will have heard by now that our current medical director, Dr. Witcher, has got a new post as the regional medical director for NHS Improvement. This is fantastic news for Emma, and I think a testimony to the hard work that she's done over the last few years at South West London and St George's. Emma's played a key role in helping to us improve services across the trust, and she will be missed here. So I wish Emma all the best for the future and good luck in her new role. I've asked Dr. Mark Potter to act up into medical director, and Mark has accepted this. Mark will start in February when Emma joins the NHS Improvement, and we will be recruiting to a substantive post for the medical director. Another change, we will have a new finance director. I'm delighted to announce that Philip Murray will be joining us as our new finance director. Philip is currently the Chief Financial Officer at Aylesbury Vale CCG. And Philip will join the Trust at the beginning of March. He's got a wide range of experience of the NHS, both in providers and in commissioners, so I'm really looking forward to working with Philip over the next few years. So I've spoken before about the development of new services as part of our acute care pathway and looking at how can we make alternatives to admission. So I'm really pleased to announce that 2 new crisis cafes will be opening in April of this year, and these cafes will provide an accessible and normal kind of cafe-like environment in South West London, operating in the evenings and weekends, where people who have got a mental health problem and feel that they're in a mental health crisis can attend and get peer support and advice. And this really is kind of an alternative to going to A&E departments, but also just general help for people. The cafes will, so as I say, operate like normal cafes, provide hot and cold drinks and snacks and a range of activities that can really support people and help to alleviate their crises. There's going to be 2 cafes, one will be in Tooting and one will be in West Wimbledon. Both have really good transport links across South West London, and we'll give you more news about those as the opening gets closer. As all of you are aware, we had a good rating by the CQC when they came to visit us last year, and our ambition really is to move on from this and to become an organisation that is viewed as outstanding. Now we recognise that this will take some time, but a key strategy to achieve that, of getting services to outstanding, is for us to have an ambitious programme of continuous quality improvement and innovation. Now we officially launched this at our leadership event on the 11th of January. So at the launch of the event we talked about how we will train staff in improvement techniques and how we will go on to support staff in making improvements in local services. Over 50 people signed up to take part in 3 levels of training, and 75 other people have been nominated by managers to take part in training. Now, we're doing this training internally with staff from the Springfield Consultancy. Many of you will know them: Mike Fern, Richard Edworth, really experienced and skilled in developing this and providing this training in other trusts across the country. Mike and Richard are leading this now in our own organisation, and I'm really looking forward to seeing the results of some of this service improvement and seeing the benefits that this will bring to us all. There's a lot more information on Insight. Please spend some time looking at what that is and sign up for some training where it's appropriate. So the next thing I want to talk to you about is a new service that we've launched, which is in response to the Francis report on Mid Staffordshire and the recommendation there that all organisations have a service which allows employees to speak up, raise concerns, address grievances that they may have. And we've launched a new service that is called the Guardianship Service. Now, this service is completely confidential, but it's aimed at staff who wish to raise things, may not wish to raise it directly with their manager, so they can do so, as I say, in a confidential manner. So you may well have seen these cards around the place. Have a look at these. This service operates 24/7. It's obviously completely free. There's a phone number on there you can call, tells you on the back exactly what this service is aimed at. And I would encourage people, if they've got problems that they don't feel that they can address with management or other colleagues, please make use of this service. It's there for you. So over the last few months, staff across the organisation have contributed to the new nursing framework that we've just developed and launched. So really big thanks to all staff that have been engaged in this, right from senior nurses and ward managers and other nurses at nursing development and practice days. So please make sure that you're familiar with the nursing framework. There are 4 elements to this nursing framework, and that is that there's time to do the job that you're trained to do. The second part of it is about how we look after the health and well-being for people who use our service and our staff. The third bit is about tailored development and career pathways to make sure that we get the best possible care, but also job satisfaction for people working here. And finally, it's about how do we utilise the skills and the personalities of every individual nurse that works in the trust, and again, using that to improve the quality of service that we provide. As I say, the details are full on Insight. There's some really helpful guides, information about how to use the nursing framework. So again, please spend a bit of time looking at that, familiarising yourself with what that is. So that's all I have to say for this month. Again, if there's any questions, please contact me, and don't forget, in terms of the guardianship service that I mentioned earlier, you can contact that as well.